So here at Reveal Dental, we believe that everyone has a story. That's actually why we created the name of the practice, Reveal, because we truly felt like in order to take care of somebody the right way, we wanted to reveal their story. We're built on relationships of trust, getting to know our patients from the very beginning, from the first time they make the phone call to when they walk out of the office. We want them to feel like they're taken care of, like they're a member of our family. And so we started the practice over 10 years ago with that premise of just hearing their story. And once we knew that story, then we could figure out what the right approach to take care of them would be. And 10 years later, we're still doing that and we're very proud. So I think for a lot of patients, what matters most is confidence. You know, we get a lot of patients who, for whatever reason, they don't want to go on a job interview, or they feel like they can't get jobs, or they have a hard time with relationships because they're just not confident in their smile. And we really try to find out, again, that story of what drives them to want to improve that smile, and then we can come up with the right treatment options to get them there. And it's really amazing when you get these stories of patients who are able to land jobs or get married or get promoted, and their life changes because of these things that we're able to do for them and the trust that they place in us to do that for them. It really drives us to continue to do it that way, and making more stories. Are you sure? One story that comes to mind was a young gentleman in his 20s that came to see me, and he was just in excruciating pain. And he had gone to multiple dental offices, and they all thought he was trying to get drugs for his pain. And when we took the time to really listen to his story, we understood that all the pain from these really massive ulcers that were growing in his mouth was actually a byproduct of some GI issues that he was experiencing, that we felt there wasn't a true connection between dental. So we said, we recommended that he go see a GI doctor, and he was later diagnosed with some inflammatory disease of his gut. And once he got that under control, his mouth sores went away.